how to help your child strengthen the muscles they use for swallowing, eating, and chewing. We are going to go over that in this feeding oral motor control interventions video. So I am OT Lifehacker. Find me on Instagram at OT_Lifehacker. And please do like and subscribe if you are a parent, going to be parent, or healthcare practitioners, nurses, physical therapists, occupational therapists, speech therapists. Welcome. Now let's get started. You first want to make sure that the child is in proper position. So that means that their pelvis is not too far out or too far in. You want to make sure they are nice and straight and tall, and that they are stable so that they do not fall over, forward, back, and avoid head extension. Head extension means bringing the head back. You want to avoid that because that can close the airways, which then can make it more difficult to swallow the food. Next, we get into hand positioning. You will put your index finger under your child's lip, middle finger under their jaw, and thumb on the mandible, which is near the ear or cheek. With this position, you will facilitate help with lip and jaw closure. So first, lip closure, you will apply slight upward pressure of the index finger under the child's lip. For jaw closure, you put upward pressure of the middle finger under the jaw. Now, inhibiting tongue thrust. What is tongue thrust? That is often when the child, say for example, you put a spoon to their mouth and you may feel that the spoon is being pushed out of the mouth because the child is pushing the tongue out. This is not a position you want the tongue to be in when the child is swallowing. And so we need to teach the child how to control the tongue thrust. How you can do that is to get a spoon, press the spoon down onto the tongue. Then to facilitate swallowing, put slight downward pressure of the spoon onto the middle of the tongue. That will keep the tongue from going forward and pushing up against the teeth and potentially causing an opening in the lips. To facilitate chewing, place food between the gum and the teeth. Also, prevent the tongue from going backwards into the mouth. Next, and very important, is tactile sensitivity. Tactile sensitivity is when the child is sensitive or bothered by touch. It is hypothesized that if children are sensitive to certain touches, then they may also have certain food preferences, as they may not want that touch or feel in their mouth. So, ways to reduce tactile sensitivity are provide firm pressure, encourage sucking on chewing cloth, rub the gums and the palate and the tongue, encourage oral exploration of toys, which means you can give the child different toys to chew on, and encourage the variety of textures of foods. Introduce mashed potatoes, for example, with other vegetables and soft food mixed inside. And last and important is promote bonding and eye contact. That will help create a very calm, pleasant social environment atmosphere for the child. Alright guys, so thank you for joining me today. Again, this is OT Lifehacker. Find me on Instagram at OT_Lifehacker, and please do like and subscribe. Any comments you have or stories you want to share, please share it in the comments below. Bye bye.